All of the weaknesses in our economy are being highlighted with the ongoing health crisis. And of course, one of the weaknesses is predatory capitalist price gouging people. So look at this from the Hill. We'll start here. Hospital CEO says supplier is charging $7 for face masks that typically cost 58 cents. Hospitals are sort of notorious for price gouging people. So you have a price gouger getting price gouged. Now you can make the case, well, this is just, normal supply and demand. And there's definitely a shortage in a crisis, but, jacking up the prices only does what? Makes it so that hospitals that are in more well-off areas that have more money are much more likely to get it than hospitals in more poor areas, which means that the people going to a hospital in a poor area, the workers there are much more likely to get screwed. So, this goes back to something that I've been pushing for a while now, which is basically everything related to health should be nationalized. I believe that. Now, again, that's not to say I think every aspect of the economy should be nationalized. I genuinely don't believe that. I think there are many areas where nationalization actually leads to worse outcomes. I think any consumer products, video games, whatever, couches, TVs, stuff like that, all consumer goods should definitely be in the private marketplace. But when you talk about big pharma, when you talk about hospitals, when you talk about health insurance, all this stuff, having the profit motive involved just always leads to worse outcomes. And we're watching it unfold right in front of our eyes. So what we really need to do, because the bigger problem is we don't have enough masks. What Trump really needs to do is invoke the Defense Production Act, which he has done, but he hasn't instructed, okay, this place is making, this factory is now going to make ventilators, this factory is now going to make masks, this company is going to be involved. He hasn't done that yet, and he needs to do that ASAP. So that's one example. Let me give you another here. This is from the Financial Times, but Mark Thompson is tweeting about it here. U.S. pharmaceutical company increased the price of chloroquine, an anti-malarial, which is one of the drugs that is being tested against COVID-19, on January 23rd. The drug price rose 98% to $7.66 per 250 milligram pill and $19.88 per 500 milligram pill. So when the outbreak first happened in China, and there was a reason to believe that this might be one of the drugs that's effective against it, they jacked up the price massively. It's a anti-malaria drug, but they say, there was reason to believe that this drug might help in fighting this outbreak, and they're testing it, and there's some promise, there's some contradictory evidence, some contradictory studies out there, but they jacked up the price, of course. So now, if all this isn't, enough for you, I do have one more story for you. This is from Time. They say the total cost of her COVID-19 treatment, $34,927.43. So what they're talking about here is a woman by the name of Danny Askini. She's uninsured. She had lymphoma, and she needed a bunch of testing and treatment because they thought originally that whatever was wrong with her was tied to her lymphoma, and the tests were coming back with inconsistent results. And so she had to go a bunch of times to figure out what was going on. And then eventually they learned she had this virus, and she got a bill for $34,927.43. Remember, this is happening at the same time that every single day the Fed is pumping $1 trillion into the banks. Every day, $1 trillion. Now, I get it. There's a difference between the Fed, the central bank, versus taxpayers and the government. I get it. There is a difference there. There is a distinction, and there is a conversation to be had. However, when you have a pandemic, to have a system where individuals can go bankrupt for their medical bills, can't afford their medical bills, I don't think people realize that a situation like this makes us all less safe. Imagine a situation where somebody works at a restaurant, they're uninsured, they have symptoms. Rent is coming up. They're not sure if they could pay the bills. So they go to work when they're not feeling so great. They don't have health insurance. They can't get the treatment. They don't have paid time off, so they can't take the time off. They don't have paid sick leave. They can't take the time off even more. So you end up going to work feeling the symptoms and spreading it to more people. All this could have been avoided. Paid sick leave, paid time off, universal health care, actually having the respective state governments and the federal government act sooner and do a lockdown sooner. It all could have been avoided. Instead, this thing is spreading like wildfire. It's ripping through the country, roaring through the country. And we got situations like this where somebody with underlying health conditions and no insurance gets billed $35,000 for treatment of this. If you don't think if people hear about this, you don't think that's going to disincentivize some people from going to get treatment, even if they have very bad symptoms? I got a bridge to sell you if you believe that. Definitely disincentivizes people. This dog-eat-dog world and economy that we live in, it's not good. It's not good. We need some very simple, basic, straightforward reforms that would improve the system and make it less vicious, less draconian. Because right now, it certainly is those things.